Hello, my name is Al Ali. I'm the Plastic Surgery Education Network Editor-in-Chief, and we're here at the Santa Fe Breast and Body Contouring Meeting. This is one of the premier breast and body contouring meetings in the world with some of the most renowned surgeons.
I think people are always excited to come to Santa Fe and find out what's new. Believe it or not, there are always new things in breast and body contouring. I think yesterday was really interesting. We talked a lot about the safety and efficacy of autologous fat grafting, for example, in the breast. I had an opportunity to give some talks on augmentation mastopexy and parenchymal techniques for mastopexy. I thought that was a very good session.
The presentations that I have given at this meeting, one was on how to select the appropriate size implant for breast augmentation. Also, I've given teaching courses on revisionary surgery, including both aesthetic and reconstructive surgery. And then one of the presentations I gave was entitled, "Why Do Patients Seek Secondary or Revisionary Surgery?" And what we did is we analyzed a series of patients to see what was the specific reason they returned to the doctor to have their surgery redone.
I had the opportunity to present some of the new advances in stem cell biology, especially adipose stem cell biology, to the audience, and reviewed some of the basic biologic principles of adipose stem cells, along with the current regulatory environment and landscape directing the use of these cells and opportunities that plastic surgeons will have to integrate this technology into their practice in the future. Bottom line is that this is a very, very promising field, exciting technology. We still need to collect more data, especially in our human subjects in well-controlled clinical trials, in order to justify claims being made about this technology, and the current regulatory environment really dictates that these procedures are done under, at the very least, IRB-approved studies and in often cases FDA-sanctioned trials.
I basically has been writing a lot of papers about body contour surgery, basically about the gluteal region and the calves. So the first participation was on an instructional course on calf augmentation and gluteal contour. And then we have another participation basically on the aesthetics of the gluteal region, which I think is the most important part of learning how to do surgery in the gluteal region. And finally, we were talking about how to do implants in the gluteal region and combining fat augmentation, hyaluronic acid, and gluteal augmentation by implants.
The focus of my talks were primarily on body contouring. I gave an instructional course on lower body lift, and then I gave an overview of technology as it has to do with liposuction and non-surgical body contouring. I was assigned a talk on what I do differently in liposuction, and that's always kind of nice to reflect back over 16 years and how my technique and my approach to liposuction has changed. And then finally finished up with excisional thigh surgery, primarily in the weight loss patient, which has been kind of an area of interest of mine, trying to improve outcomes with that.
One thing I really like to get from meetings like this is different things people are doing regarding patient safety. And I learned a lot of little tidbits for patient safety, and you know, I think that's helpful for the patient. And in fact, when you talk with the patient in a consultation process, they like to hear that, hey, you're going to do things the safest way that can be done.
It's a great meeting. I've come many, many times. It has to do with the quality of the faculty, the timeliness of the topics, and probably as important as anything, the location.
The technique for safe liposuction, Simeon Wall, I've done a little bit of that, but he really kind of made it all come together and made it very understandable, and it seems like a really good technique to use. The other thing they talked about today in terms of using no lidocaine in tumescent solution with no change in patient's pain perception, but less complications related to lidocaine.
We had a panel with people, including myself, talking about progressive tension sutures, and it was a very lively discussion comparing a variety of different techniques, including fleur-de-lis type excisions, aggressive liposuction techniques, and led to a very interesting discussion with that included the audience.
I will definitely be coming back. It's a regional meeting that I find highly practical to my practice and easy to get to with some incredible faculty. So this is one of my top meetings I try to get to on in my young career in a semi-annual or annual basis.
It's not just like a big meeting that you get lost between all the courses. And all the courses are very instructive, and good video they show. Overall, I think is a more personal type meeting. And you can meet the speakers, talk to them easily.
I'd like to encourage everybody to attend the Santa Fe Breast and Body Contouring Symposium. We just finished the 2012 meeting, and it was spectacular. We had a variety of new faculty, we had new topics, different format. We had instructional courses that were exceptionally well attended, and they're all free, so everybody can go. Probably 20 different instructional courses. The main body of the symposium had some wonderful topics, cutting-edge materials. We had outstanding faculty. We had Scott Spear giving us updates on nipple-sparing mastectomy. We had Jim Grotting talking to us on other augmentation mastopexy techniques. The body contouring portion was phenomenal. We had some of the best people in the United States sharing their tips and traps, and really just a fantastic meeting.
In 2013, what we're going to do is we're going to take what we've learned from this meeting, and we really do listen to what people say and the suggestions they give us. As a perfect example of that, coming back here to downtown. And we will also look at the program and how well it was received in the areas that people want us to emphasize again, or new areas that they want us to emphasize. We're excited about it. And we will continue on with our mission of keeping with the old, but also adding new, exciting blood into the arena of breast and body contouring.
This is one of the joint ASPS-ASAPS meetings. We continue to have a great collaboration, and this was an incredible success. We had over 200 people, almost 220 people at this meeting. Next year, I think that probably, now that word is going to get out there that we're back in Santa Fe. A couple of years we took a break and we're out about a half-hour away. We're right smack in the middle of the action and working together closely with our sister society. This is a great success, and we will continue to work with them wherever we can to try to get the best content for our members.